Question number 1. What is the first step in basic life support BLS? The right answer is option B. Check responsiveness. Question 2. In a patient with suspected cervical spine injury, how should the airway be open? Right answer is option B. Jaw thrust maneuver. Question 3. What is the priority nursing action for a patient with anaphylaxis? The right answer is option B. Maintain airway and administer epinephrine. Question 4. A patient suddenly collapses in the ward. What is the first action? The right answer is option A. Check for breathing and pulse. Question 5. What is the priority nursing intervention for a patient experiencing a seizure? The right answer is option C. Maintain airway and turn to side. Question 6. Which of the following patient should the nurse see first? The right answer is option B. A patient with chest pain and diaphoresis. Question 8. A nurse is caring for a patient with increased intracranial pressure. What is the priority intervention? The right answer is option B. Elevate head of bed to 30 degree. Question 9. The priority action for a patient with acute myocardial infarction is. The right answer is option C. Administer oxygen. Question 10. Which of the following conditions require immediate intervention? The right answer is option B. A patient with aura of 10-minute and kenosis. Question 11. Which of the following should be given first in an acute asthma attack? The right answer is option A. Salbutamol nebulization. Question 12. Which medication should be administered first in a patient with a high potassium level? The right answer is option B. Insulin with dextrose. Question 13. The nurse is administering digoxin. What is the priority assessment? The right answer is option B. Apical pulse. Question 14. What is the priority nursing action for a patient on warfarin with an INR of 5.0? The right answer is option A. Administer vitamin K. Question 15. Which medication should be given immediately for a patient in anaphylaxis? The right answer is option B. Epinephrine. Question 16. What is the antidote for morphine overdose? The right answer is option B. Naloxone. Question 17. A patient on heparin develops severe bleeding. What is the antidote? The right answer is option B. Protamine sulfate. Question 18. Which drug should be avoided in a patient with renal failure? The right answer is option B. Metformin. Question 19. What is the first line treatment for bradycardia? The right answer is option B. Atropine. Question 20. Which drug is the priority for treating an opioid overdose? The right answer is option B. Naloxone. Question 21. The first nursing action for a postpartum patient with heavy bleeding is. Right answer is option A. Give oxytocin. Question 22. Which position is best for a patient in shock? The right answer is option C. Modified Trendelenburg. Question 23. The priority nursing action in eclampsia is. The right answer is option B. Give magnesium sulfate. Question 24. A newborn with a heart rate of 50 bpm needs. The right answer is option A. Chest compressions. Question 25. The best method to prevent infection in a newborn is. The right answer is option B. Hand washing. Question 26. What is the priority nursing action for a patient with septic shock? The right answer is option A. Start broad spectrum antibiotic. Question 28. 27. A patient with a stage 3 pressure ulcer required which priority intervention? The right answer is option B. Perform wound debridement. Question 28. What is the best way to prevent ventilator associated pneumonia? The right answer is option B. Elevate head of bed. Question 29. The priority nursing action in a mass casualty disaster is. The right answer is option B. Triage and prioritize. Question 30. In the triage system, which patient should be seen first? The right answer is option B. A patient with a head injury and unresponsiveness. Question 31. What is the best infection control measure in healthcare setting? The right answer is option B. Hand hygiene. Question 32. Which infection control precaution is required for a patient with tuberculosis? The right answer is option B. Airborne precautions. Question 33. A nurse accidentally sticks a used needle into her finger. What is the first action? The right answer is option A. Wash the area with soap and water. Question 34. Which patient should be placed in protective isolation? The right answer is option B. A neutropenic chemotherapy patient. Question 35. A patient with Clostridium difficile require which infection precautions? The right answer is option B. Contact. Question 36. What is the priority nursing intervention for a patient with a stroke? The right answer is option A. Start thrombolytic therapy. Question 37. A patient forced thyroidectomy reports tingling in the finger. What is the priority action? The right answer is option A. Administer calcium gluconate. Question 38. A patient on a ventilator has an oxygen saturation of 85%. What is the first action? Right answer is option B. Check tube placement. Question 39. The best position for a patient in heart failure with dyspnea is. The right answer is option B. High Fowler. Question 40. A patient on furosemide should be monitored for. The right answer is option B. Hypokalemia. Question 41. A patient receiving IV potassium chloride KCl complain of burning at the IV site. What is the priority nursing action? Right answer is option B. Stop the infusion. Question 42. A patient on insulin therapy reports sweating, dizziness, and confusion. What is the priority action? The right answer is option A. Check blood sugar. Question 43. Which lab value should be monitored for a patient on lithium? The right answer is option A. Sodium level. Question 44. A patient with a hip fracture suddenly developed dyspnea and confusion. What is the priority intervention? The right answer is option B. Administered oxygen. Question 45. What is the first action in a patient experiencing a blood transfusion reaction? The right answer is option B. Stop the transfusion.